Thank you very much. Secretary Becerra, thank you for being here. I want to touch on a few different topics today. First, I would like to commend the administration for prioritizing vaccine equity and the distribution of vaccines into our underserved communities. As a doctor and public health expert vaccinating my constituents in underserved communities, I can say firsthand that President Biden's federal retail pharmacy program, mobile clinics, and direct vaccine allocation to FQHCs are effective. However, we still have a ways to go in reaching a national herd immunity, and I'm concerned by reports that vaccine rates are plateauing. While around 50% of Americans still need to be vaccinated, and with underserved communities still having low vaccination rates. In fact, the Desert Sun newspaper reported this week, after analyzing California HHS and Census Bureau data, that vaccine rates are still significantly higher in the white, older, wealthier zip codes in my district by up to 30% compared to poorer, younger minority communities. While some of that could be because older people were first to get the vaccine, older individuals in underserved communities still lag behind, and all ages have been eligible since mid-April. Secretary Becerra, since we have reached a plateau in vaccination rates, has there been a shift in the administration's efforts and methods around reaching the individuals that have not yet been vaccinated to address barriers like time, language, and transportation restraints?
Congressman Ruiz, great to see you. And the answer is absolutely yes. There have been changes made. In fact, later this week, I will be going to a rural community in California where there will be a small vaccination clinic targeting folks who are the most underserved and the most difficult to reach in some of our rural areas.
Thank you. I think that's very, very critical to partner with local communities and taking the vaccines to the people. And I applaud your efforts in doing that. So now pivoting to an issue that this committee worked on prior to the pandemic, which is surprise billing. My Republican colleague, Dr. Bouchon, and I worked with several of our colleagues in a bipartisan manner to craft a solution that would first and foremost protect the patient from surprise medical bills and to create a solution that is fair to both providers and insurers, which included a baseball style arbitrator independent dispute resolution process that this committee and Congress adopted. And so I would like to ask you some questions regarding the implementation of the law. So first, regarding the IDR process, I urge the administration not to weigh any one factor to be considered by the arbitrator more heavily than the others. The legislation signed into law represents a balanced approach that treats providers and insurers equally and does not favor one party over another. I'm concerned that if any of the factors are weighed more heavily than the others, it will tilt the balance, resulting in an unfair system that will unintentionally lead to a benchmark rate which runs counter to congressional intent. Second, it is my understanding that HHS is meeting with stakeholders and requesting their input. I appreciate the administration soliciting feedback. I strongly urge you to move forward with a proposed rule that includes a full public comment period so that the process is transparent and all stakeholders have an opportunity to comment and provide feedback. Mr. Secretary, have you made a decision on the rulemaking process and whether it will include public comment?
Congressman, thanks for all the questions. We're going to make sure that people have an opportunity to know what's going on with these rules. We're going to try to move them as quickly as we reasonably can. What I will tell you is this, Paramount will be making sure that the patient doesn't get in the mix of any fight that may exist. We're not going to weigh any side more than another, and we're going to make sure that we launch these committees as quickly as possible. That'll help us make these decisions because everything you said is accurate.
Thank you very much. And for my final question, I'd like to ask about an issue near and dear to me, advance appropriations for the Indian Health Service. As you know, IHS is severely underfunded and continuously struggles financially, which hurts patients' access and care. So, Mr. Secretary, can you talk about the benefits of advance appropriations and how it will help the IHS better serve our tribal communities?
Our tribal communities, as you know, Congressman, have been underfunded, severely underfunded for too many years. President Biden has now made a major commitment to restore some of that funding, but he's also made the commitment that Indian country has been asking for a long time, and that is that they be treated when it comes to health the way we treat every other aspect of healthcare for all other communities, and that is that they have predictability in their funding moving forward. And that's why the advance appropriation is so critical, and that's why with your help, we'll get that done.
Thank you very much, Mr. Secretary. I yield back my time.